Psychiatric question 1. When a client with major depression is considering cognitive therapy, the client says to the nurse, "How does this treatment work?" The nurse responds and tells the client that 1. This type of treatment helps you examine how your thought and feeling contribute to your difficulties. 2. This type of treatment helps you examine how your past life has contributed to your problems. 3. This type of treatment helps to confront your fears, gradually exposing you to them. 4. This type of treatment will help you relax and develop new coping skills. The correct answer is 1. This type of treatment helps you examine how your thoughts and feelings contribute to your difficulties. 2. Which statement made by the nursing assistant indicates to the registered nurse that the assistant understands the concepts related to suicide? 1. When a person makes suicide threats, the only thing that person wants is attention from the families and friends. 2. Discussing suicide with a client is not harmful. 3. Depressed clients are not only the people who commit suicide. 4. Those clients who talk about suicide never do it. The correct answer is 2. Discussing suicide with a client is not harmful. 3. Which of the following individual is at highest risk for committing suicide? 1. A 24-year-old outpatient client who just had argument with co-worker. 2. A 71-year-old client with a cardiac disorder. 3. A 75-year-old male client with cancer. 4. A 30-year-old newly divorced client who has custody of the children. The correct answer is 3. A 75-year-old male client with cancer. 4. A nursing instructor is teaching a group of nursing students about violence in the families. Which of the following would not be a component of the information presented? 1. Abusers usually have poor self-esteem. 2. Abusers use fear and limitation. 3. Abusers are often jealous or self-concerned. 4. Abuse occurs more often in low-income families. The correct answer is 4. Abuse occurs more often in low-income families. 5. A client with depression who is taking sulfate has been instructed on diet. The nurse determines that the client understands the diet if the client selects which food from the dietary menu. 1. Pepperoni pizza, salad and Coca-Cola. 2. Roasted chicken, roasted potatoes and beer. 3. Pickled herring, french fries and milks. 4. Fried haddock, baked potato and Coca-Cola. The correct answer is 4. Fried haddock, baked potato and Coca-Cola. 6. A client is being treated depression hydrochloride during the initial phase of treatment. The most important nursing intervention is to 1. Provide a client thiamine-free diet. 2. Obtain frequent drug blood levels. 3. Obtain postal blood pressure on the client before administering each dose. 4. Assess the client anticholinergic effect. The correct answer is 3. Obtain postal blood pressures on the client before administering each dose. 7. A client who is taking lithium carbonate will be discharged at the end of the week. In formulating discharge teaching plan, the nurse plans instruct the client that is the most important two. 1. Avoid soya sauce, right age cheese. 2. Take the medication only prescribed because it can become addicting. 3. Check the psychiatrist before using any over-the-counter of the medication. 4. Have the lithium level checked every 2 weeks. The correct answer is 3. Check the psychiatrist before using any over-the-counter of medication.